Numerous doctors and nurses have been allowed to practice without oversight, despite facing serious accusations of sexual assault and rape over the past 6 years. From 2018 to 2024, approximately 248 doctors encountered serious allegations of rape, sexual assault, or attempted rape, yet their licenses were not suspended, according to new data from the General Medical Council, GMC. The Nursing and Midwifery Council, NMC, embroiled in scandal, allowed over 400 nurses to work without restrictions after allegations of sexual offenses emerged between 2019 and 2024. The alarming statistics, acquired through a Freedom of Information (FOI) request, raise serious doubts about the judgments made by the UK's two principal health regulators following numerous exposés. Health Secretary Wes Streeting convened with NMC Chair Sir David Warren at the end of last month to discuss the issues highlighted by these allegations. Between 2018 and 2024, 11 doctors were implicated in possessing indecent images of children, yet no interim orders were enacted. Concurrently, 261 doctors faced no limitations despite allegations of physical violence. In 2018, a doctor accused of murder was allowed to practice without any restrictions placed on them. Another doctor found guilty of sexually assaulting colleagues was permitted to continue working, as long as he notified the GMC about his job transitions. Dr. Becky Cox, a GP and founder of Surviving in Scrubs, an organization representing assaulted doctors, stated, "We are extremely worried by this data, which indicates that a low percentage of doctors accused of sexual assault receive interim orders to restrict their practice while investigations and tribunal processes are ongoing. We strongly urge the GMC to implement effective measures for the safety of patients, staff, and the public during investigations." The FOI data presents the annual count of doctors and nurses facing allegations without interim suspensions or limitations. It does not clarify how long they practiced under these circumstances. Interim orders can be imposed on doctors' licenses if the GMC determines adequate evidence is present, with the Medical Practitioners Tribunal Service, MPTS, determining the sanctions, which may include suspension. For nurses, the NMC can advise its fitness to practice panels to establish an interim order when necessary. Helen Hughes, CEO of the charity Patient Safety Learning, remarked that the figures are deeply concerning from both patient and staff safety standpoints. She stated, "In healthcare, patients often face a significant power disparity. When serious allegations arise against healthcare professionals, it is crucial to establish rigorous procedures to protect both staff and patients throughout the investigation." Jacob Lant, CEO of National Voices, a coalition of health and social care charities in England, commented on the data, "These are some very serious allegations raised, and in such situations, communities rightly expect NHS leaders and regulators to fully utilize their powers to prioritize patient safety while investigations are processed." The data illustrates that when doctors do receive interim orders, the majority are not suspended. Instead, conditions are placed on their practice. One transplant surgeon in Oxford, James Gilbert, faced an 8-month suspension after a fitness to practice hearing determined that he sexually harassed female colleagues, made racist remarks, and abused his senior role. 3 of his victims were trainees. Previously, this surgeon had interim conditions on his license that only required him to inform the GMC of his work location but did not restrict his work capacity. In another case, the GMC found itself challenged in the High Court by its own regulator, the Professional Standards Authority, PSA, over an excessively lenient 6-month suspension for a doctor accused of engaging in sexual relations with a vulnerable patient. The PSA contended that the GMC failed to consider the patient's vulnerability, resulting in the High Court imposing an additional 6-month suspension for the doctor. A spokesperson for the Department of Health and Social Care stated, "Any form of sexual violence or misconduct is intolerable and must be thoroughly investigated and penalized. All healthcare professional regulators bear a legal obligation to safeguard the public. Both the GMC and NMC hold the authority to temporarily restrict registrants' practice while addressing concerns to ensure public safety." The GMC affirmed its commitment to taking all allegations seriously, with all incidents of sexual assault, rape, or attempted rape being referred to the external MPTS post-investigation unless exceptional circumstances arise. Anthony Omo, the GMC's Director of Fitness to Practice and General Counsel, declared, "We maintain a strict stance against any kind of sexual assault, harassment, or discrimination in the medical field." In numerous cases involving sexual allegations, the GMC's stance is that such severe misconduct disqualifies individuals from continued registration. He added, "Earlier this year, we implemented updated professional standards for doctors, encapsulating a zero-tolerance approach to sexual misconduct and clarifying that any sexual conduct towards patients or colleagues is unacceptable." In the past year, the NMC reinforced its guidance for staff regarding sexual misconduct and other abusive behaviors involving nurses outside their professional roles. It emphasized, "We treat allegations of sexual misconduct with utmost seriousness, and our data demonstrates that the predominant sanction imposed by panels following proven charges is a striking off order." Thank you for staying informed on this important issue. Please like and share your thoughts in the comments.